Good evening, everyone, and welcome to Atp Live Monday. Whichever platform you're watching me on, welcome to ATP Live. Thank you to those of you who are joining on Instagram, and some of you are joining us on Facebook as well. Welcome. Thank you so much for joining us. ACP Live Monday is a program brought to you by Ask the Pediatricians Foundation. It's a program where you get to ask any questions that you may have about the health of your children, and you get answers live from the pediatrician in the next 1 hour. Remember that you can always watch repeat episodes even after the live session. And if you still have questions beyond the live section, you can post this on our Facebook groups for answers as well. So thank you so much for joining me. So I invite you to help me share the video, invite friends and family so that we can all learn together. So whichever platform you're watching me, just help me to share to your friends, share to everyone, and then you can start to drop your questions as comments on Instagram or on YouTube, or if you're watching on our Facebook group, you can also drop your questions there as well. But if you're watching on Ask the Pediatrician Facebook group, you can drop your questions straight away. But if you're watching on ATP Family or ATP Still a Mom or FTM Facebook group, all our other Facebook groups, you will have to click on the video so that you can get to where I will be able to see your questions. So that's just the only difference. But if you're watching on Ask the Pediatrician Facebook group, I can see your questions straight away. If you're watching on our page, ACP Foundation page, I can also see your questions. And if you're watching on YouTube, Instagram, I will see your questions straight away as well. All right, so just a minute. I'm also just sharing it and making sure that everybody can see and they can hear me, and then we are good to go. So I can see some questions already coming in on Instagram. Feel free to keep dropping the questions. I just want to make sure that everybody is seeing it now. Okay, I guess I've done all the sharing. Let me just pin them, and then we are good to go. So please drop your questions. As you're dropping your questions, please start with the age of the child, okay? Don't say my baby, my baby. Everybody is always saying my baby, even the 10-year-old and the 20-year-old are still babies. So please make sure you start with the age of the child. If you want to ask me about the weight and all that, your baby is small, your baby is not growing, please tell me the birth weight and the current weight of the baby. This will make it easier. Remember things like I can't see pictures. If you're asking questions about rashes and all that, I really need to see them. And because you won't be able to post a picture, it may be useful for you to just post those kind of questions straight to our Facebook group so that we can see them. And I will still see them. I will always see and I will answer them. So those are just like background rules that will make so that I won't have to ask so many questions. Try and keep the questions straight. Please ask questions. Don't just drop comments and tell me my baby do this, my baby do that without asking a specific questions. If you don't have specific questions, I won't know what to do with that information. And I always don't want to assume, because sometimes you assume and you're still wrong as well. So I always want you to tell me what you want me to do with any information you give me. I want you to ask very, very specific questions so that will make life easier for all of us. Okay, I think I've done enough introduction. Welcome again for those who are just joining us. Welcome to ATP Live Monday. My name is Bimisola Boyede. I'm a pediatrician. I am the CEO Axi Pediatricians Foundation, and my job this evening is to answer any questions that you may have about the health of your children in the next 1 hour that I have. But not to worry if you don't have if you still have questions after the live session, remember that you can always post your questions on our Facebook page from Mondays to Saturdays, and we'll be there to answer you. Unfortunately, we can't offer that service on Instagram. So Instagram people, apologies, but feel free to post your questions on our Facebook page. All right, thank you. So let's start with Instagram. The first question is from Lumi Stride. Okay, so this is Lumi Stride. Say hello ATP. My babies are 6 months. What snacks can be recommended, please? There's premise and all that. So have you started complementary feeding? I think that's where I want to start first. So complementary feeding number 1. And so complementary feeding is the first thing you start with. So if you have started complementary feeding, that's good. When it comes to snacks, you can give what we call healthy snacks. And remember, when you're starting complementary feeding, you need to remember the frequency of feeds and of like 6 months old. Usually we don't even start them on snacks at that age. We just want them to have 2 meals a day. Okay, by the time they're going to 7-8 months, then you can have 2 meals or 3 meals, 2 to 3 meals a day with one snack in between, and that snack can be your fruits. So it can be something as simple as a banana. It can be any of the fruit, to be honest, that the child can, you can cut into tiny pieces and that they can chew on, munch on. It can be simple, like even your egg, you can boil egg and cut for them. So it's just something they can have in between their meals, the 2 complementary feeds. Of course, for your 6 months old, you are still supposed to be breastfeeding them as much as possible. So, but usually at this age, anything you're going to give for snack, make sure it is soft, make sure it's something that they can that they can easily swallow, not hard. And please don't give them things like biscuits, all those pastries and all that. Those are not snacks. Okay, those are junk food and we don't want you to give. But you can use any of the fruits as your snack for the children. So I think that's what I would recommend for now. All right, if you have more clarity, if you need more clarity on that, please ask. But more importantly, I hope you have done our what we call guide 2 on complementary feeding. If you have not done that, I would say you should start with that first. Okay, Miss D. James, good evening, ma'am. I noticed green and red patches on my 3-month-old back. Okay, was the baby born with it? So when you notice patches on your children's body, I always want to know whether the child is born with it or not. So if your child is born with those patches, sometimes they are just what we call birthmarks. So for a dark-skinned baby, greenish, what look greenish to you may just be what we call Mongolian spots, which is a kind of blood vessel, there's a medical jargon for it, but I don't want to also make it more worrisome for you. But it could just be a birthmark, and most of them you don't need to do anything about birthmarks. They are going to resolve by themselves. So if the red or the green or the black patches were born, the baby were born with them, most likely they're birthmarks and you don't need to do anything about them. But if the baby was not born with them and it's something that started newly, then we need to see it so that again you can post a picture. Please, if you want to post a picture of your child on social media, please don't post their pictures naked. I know mothers, we don't think that babies newborn require privacy, but they need their own privacy even as a newborn baby. So don't just take pictures of babies completely naked and just post it as if there's no big deal there. Please don't. So always make sure, most of the time I always decline those pictures. Make sure they wear nappies and pants and take the picture. The child privacy must always be protected every time. That's number one. Number two is also Facebook and social media will interpret it as what we call child pornography. They won't know you are posting it for medical reason. So when you post it to health professionals, you're actually putting us at risk. We can't afford to download those pictures to our phone. We can't afford to have pictures of naked children on our phone. It will be counted as child pornography. It's a criminal offense. So please make sure you take the right pictures when you're posting pictures of your children. Okay, Chomi for King, our constant constant fan. Let me put it that way. Okay, good evening. My baby is 13 months old. The temperature is normal, but the body is always hot. Okay, that sounds contradictory to me. So if the child is hot and the temperature is normal, then the child is not hot. So did you use a thermometer to measure the child? So if you use a thermometer to measure the child and the thermometer reads anything less than 37.5, that is normal. It doesn't matter what you feel. And like I always like to say, that is why there was a need for us to have a thermometer in the first place, because our hands are not reliable as a mom. So we can't rely on your hand. We need an instrument. And that's why, unless you think your instrument is faulty, which is also okay, you can get a new one, or you can take your child to a hospital and let them use their own thermometer in the hospital to check as well. So if they check, and if you check and your thermometer is normal, your temperature is the thermometer is normal, and the one in the hospital is also normal, then that child is saying the body is not hot, and that is the end of that. So okay, you've asked the question twice. Ms. James, I went through posts on Facebook, read about breast milk storage. It can last up to in room temperature, but CDC recommend 4 hours. Which should I follow? Follow anyone, okay? Follow anyone that you like. All right, but 6 hours is what we recommend, and it's fine. I think it also varies from place to place, but 6 hours is okay. But if you have a fridge, just put it in the fridge. There's no need for you to, unless you don't have fridge, and that's where you want to do it at room temperature, but it's okay. But if you have a fridge, just put it in the fridge, so you don't have to worry about that. Okay, Chami for Ken, you're asking the same question 3 times. I've answered your question. If the temperature is taken by a thermometer, which is a digital thermometer, and it is normal, then it is normal. It doesn't matter what you feel. The thermometer is more reliable than your end. Alternatively, if you want to confirm, take the child to another doctor or hospital, let them check the temperature for you. And if it is still normal, then it is normal. And that is what it means. Okay. Is it okay to feed your 3 months old 2 to 3 ounces of breast milk? Okay, why are you expressing your breast milk? If your baby is a term baby, let your baby suck directly on the breast, and there's no reason why you have to make it like you have to do every 2 hours, you have to do every amount. What we recommend is breastfeed your baby on demand. Let your baby suck directly from the breast, and your baby can suck on demand. And usually for big term babies, 2 hours is too frequent. 3 hours is fine. 3 to 4 hours is fine. But you don't even have to put your baby on the schedule. Just breastfeed your baby directly from your breast, and as often as the baby wants it. But if you are not at home and your baby is you are leaving the baby for other people to look after for you and all that, and like if it's a term baby, every 3 hours is fine, and that's how we recommend. And or when baby cries for food or baby showing feeding cues, then you can feed the baby. All right, let me take a break from Instagram people and go to Facebook, because Facebook people have kind of filled the room now. Somebody say I'm always excited to join. Thank you. Facebook group, I can't see your name, so it's a little bit difficult. But so try and make sure you put your posts as one. Don't break it, because I won't know how to attach them together. All right. Somebody say good evening, Doc. Thank you for all you do. My baby turned 15 months last week. Birth weight is 2.9, current weight is 12 kilo. Is it okay? It is okay. All right, that's a little bit actually more than okay. But we expect your baby to weigh like 10 kilos at 1 year. So 12 kilos is upper side of normal, but it's still okay. All right. Somebody say, good evening, Doc. Okay, it's the same question. Okay. Also, my boy seems to have bow legs. Will it be lack of vitamin D? Do I need to see a pediatrician? Okay, so bow legs depends on how severe the bowing is. So sometimes I always prefer you see a doctor first. Let them look at it. So sometimes it could just be a normal thing. Some people tend to have slight curvature of their legs in their family. There's nothing wrong. It's not vitamin D deficiency. There's nothing. But sometimes it could also be rickets, vitamin deficiency. Usually that tends to be more um very pronounced. There are also other medical conditions that can affect bones and all that. So it may be better for, because your baby is 15 months or so, you should be going to the hospital for at least your immunization or something. So there's any one reason you should go to the hospital anyway. So let a health professional, a doctor, a nurse, let them just have a look at it. And usually if I see that, I will just do your bloods, like check the calcium level, check all those things, just like routine check, just make sure everything is fine. If everything is fine, then we can relax. But if it's significant or there are other symptoms that worry, a pediatrician, then we will now begin to look further for other causes of bull legs and all that. But sometimes we just be normal. If the child is otherwise well, everything else is fine. We just watch. But if there are other things that worry us, then we will investigate it. All right. All right. Good evening. My baby birth weight is 3 kilos, weight at 2 months, 5 kilos, ABF. Baby doesn't poo every day. Yes, babies on exclusive breastfeeding don't have to poo every day. They may not even poo for up to 2 weeks, and that is normal. It is nothing to worry about. No need to take the child to the hospital. Just leave the child alone. Just keep breastfeeding. All right, that's perfectly normal. Okay, you've asked about the bow legs. I think it's the same person. Good evening. My baby is 2 years old and she has been having cough for 1 month. Okay, you have to go to the hospital. So if your baby is coughing for more than 2 weeks, we classify that as chronic cough. And anything that is chronic cough has to be seen by a doctor. So there are other causes of cough. So most children have cough that are due to viral infections, like usually so you will expect that to clear within 2 weeks. Most of them don't require any treatment and it will go away. But if your child is coughing for more than 2 weeks, and that is too long, and we need to be sure. I don't know what drugs you were given before, but you need to go back to the hospital. So at this point, we have to start thinking, do we need to do a chest x-ray? Do we need to check for tuberculosis? Do we need to check for asthma? Do we need to check for things that will make a child to cough for a long time? And anything more than 2 weeks is long from our perspective. So 1 month is too long. You have to take this child to see, unless it's cough, it's coming and going. Even then, I still want a pediatrician to have a proper look at the child, examine the chest, and make sure there's nothing else going on there. All right, the next question. Good evening, Doc. How many teeth should a 15-month-old baby have? It doesn't really matter. Some may not even have any. Okay. But usually, averagely, most of them may be having like between 4 to 8 teeth. But everything is a range. Some children bring out all their teeth almost at once. Some will bring out 2 or 4. It doesn't matter. The most important thing for us is that the child actually have teeth. Actually, so if your child has 8, it's okay. It's fine. You don't need to worry about it. Okay, let's go back to Instagram. Okay, I don't think I have any questions apart from Miss D James. Okay. Somebody is requested to join my live video, but no, actually we don't allow that. Okay. All right. So feel free to post your questions and I will answer them within the next hour. Adiola Da Costa. Good evening, Doc. My baby is 8 months old. Our poo is hard. Okay, so that may be constipation. You've not asked any question. Please always ask questions. But I want to assume you are asking what to do about it. But that could be constipation. And then that boils down to what are you feeding your baby. So we want your baby to be on complementary feeds, and at 8 months they should take water. So when you give them food, make sure you also give water. All right, they should be drinking water. You should be taking fruits and vegetables. So make sure you are not just giving only pap and milk or cereal and milk, which is what sometimes some of us put our children on when they are on complementary feeding. It's just pap and milk or cereals and milk. So make sure you are adding other things to the complementary. Make sure there are food that are rich in fiber. Make sure there are fruits. You can add veggies. Make sure there are that, and the child drinks water as well. So those are the things that will make sure the child is not constipated. Some of you also give formula. To be seriously speaking, formula feeding is really not part of complementary feeding. The child needs milk, but we expect that you should keep breastfeeding your child. And if you are breastfeeding your child, most of the milk the child needs will come from breast milk. But if for any reason your child is on complement on formula as well as source of milk, make sure you are mixing it properly. Don't add make sure you add you constitute the milk the right way, you know, the amount of scoop for the right amount of water and all that is very, very important. And if you are adding the milk to the pap as well, you still have to follow that ratio. So just like the same ratio you would do when you're adding the milk to the pap. So I mean to water, because some of you just pour the milk as the spirit leads and it's too concentrated, and that can also make the child to be constipated as well. So those are precautions that you need to take and to avoid constipation. But more importantly, make sure that that child take fruits and take vegetables and drink water. That will take care of constipation. And if you are doing all that and your child is still constipated, then you have to take the child to the hospital because there are other reasons why children could have heart stools, constipation, and sometimes we need to give the children what we call stool softener drugs that will make the stool to be soft so that they can find it easier to pass out. But most of the time it's diet related and nothing medical. All right. Somebody said I'm excited to join. Thank you so much for joining. We appreciate you. Thank you so much. If you are just joining us, welcome to Atp Live Monday on Instagram, on Facebook, on YouTube, on Facebook page, whichever platform, Facebook group you're watching from. Thank you so much. This is a program where you get to ask your questions in 1 hour and get live answers. But if you have any question beyond the live session, remember you can post it on our Facebook group from Mondays to Saturdays, and we will try our best to answer them. Thank you. Some of you do always send me questions on Sundays. Unfortunately, we don't run on Sunday. So it's either you use our search option, like you can search your question. I doubt there's any question anybody is asking that we've not answered before. So you can search and use those previous answers, or you can, if it's something important, urgent, of course, you have to go to the hospital. There's always a doctor in the hospital for children. All right. I got a question. Good evening. My baby will be 6 weeks next tomorrow. He always gets choked each time he's breastfeeding. That is not normal. It's not normal for a child to be choking while breastfeeding. So there are many possible things that could be going on, but the most common is the fact that when you're breastfeeding children, you need to be make sure you are not blocking the nose with your breast. That's number one. That's why sometimes you have to make sure you put your hand to support your breast so that it doesn't, block the nose, because children need to always breathe through their nose. They are what we call obligate nasal breathers. They always need their nose open. So if the child is not able to breathe through their nose because you are blocking the nose with the breast, then the child will want to breathe through their mouth, and then they are going to want to take a breath while sucking at the same time, and that could lead to them choking on the breast. That's number one. Number two, some children are like rushing the breast so much. They are very greedy about it, and they don't pause to breathe. There's what we call suck and swallow. They need to, when you suck, you need to take a breath and swallow, then suck and swallow. So sometimes some children just don't get it right. So sometimes all you need to do is to slow them down. So you can take out the breath from their mouth, let them have a breathing space, and then you start again, and they will be slower and all that. But the most worrisome for us is some children actually have some abnormal connection between the airway and the food way. So the airway or the trachea is in front, and the esophagus, which is the food way, is behind. Sometimes for whatever reason or the other, they say an abnormal connection. The two of them should not connect. They should not connect together at all. But sometimes there's an abnormal connection, and when such children suck, they choke on the breast. So usually we expect that doctors should have picked it up from the hospital, but sometimes we miss them, and it may be through this episode of your child choking on the breast that we know that this child may have an abnormal connection. So you have to take that child to the hospital. We have to check it first and make sure there's no abnormal connection between the airway and the foodway. But the most common cause is actually the not breastfeeding properly, or the child sucking, rushing the breast and not taking time to breathe. So you just take them, give them a break, rub their back gently, and then restart the breastfeeding. And sometimes, and when you finish feeding them as well, there's also what we call reflux. Okay, so I always explain that the distance between the baby's mouth and the stomach is very short. It's a very short distance. The stomach is also small. There are also some gates, what we call sphincters, to block the food pathway and the stomach, so that food cannot go back the way it comes. And remember, it's liquid food, it's milk, and the baby, sometimes, most of you, when you finish feeding the baby, you just put them flat. So all those things make it easy for food to go back the wrong way. So you put down the baby immediately after you have finished breastfeeding them. The distance between the stomach and the nose is very short. The gates that should block is not properly well mature yet, so it's not blocking it. So it's easy for milk to come back, back to the nose, back to the mouth. And that's what we call reflux. So that's why we say when you finish breastfeeding babies, don't put them down straight away. Keep them in a vertical, upright posture. Rub their back, let the gas, they may have also suck into the stomach, let those ones come out, and then let the mix settle, and let some process of digestion start. Maybe 15 to 30 minutes before. Some babies are very, some maybe have it bad, some maybe it's not so bad. So make sure you do all that before you put the baby down. So that should reduce the baby choking on the breast. So you do all these things I've said, and when you go to the hospital on 6 weeks for your immunization, make sure you also talk to your doctor so that they can check for the whether there's any abnormal connection that can explain the choking on the breast. I hope that's helpful. All right, Instagram people, I can't see any question on Instagram, so I guess you guys are good. All right, let's go on to Facebook. The next question, when should I put my baby to sit? She's 3 months. Okay, the simple answer is that you don't need to put your baby to sit. Okay, baby will sit by themselves. Baby will do all the milestones. You don't need to teach babies milestones. You don't need to force them to do anything. So when your baby is ready to sit, baby by himself will start, putting themselves into that sitting position. And most babies will start to sit with support from 5 to 6 months. So in other words, when they put themselves into that sitting posture, they are not yet able to sit straight the way I'm sitting now. So they tend to bend forward. So what you need to do, you need to support their back. You need to either sit behind them or you put something behind them so that you support their back. But by the time they're about 7, 8 months, they should be able to sit straight without you supporting their back. And then 9, 10 months, they start to crawl. But these children do it by themselves. It is due to their brain maturation. It has nothing to do with you teaching them or forcing them into the sitting position. What I want for your 3-month-old is to have neck control. Can the neck of your 3-month-old stay straight? In other words, when you carry your 3-month-old, when you pull them, if they're lying down flat and you pull them with their 2 hands and pull them forward, does the head come up with the rest of the body, or is the head still falling back? So we want the head to come up with the rest of the body. That is neck control. Or when you put them on your back, their head is straight, it's not falling like this. So that's what we want for a 3-month-old, not sitting. Sitting is from 5 to 6 months. Some babies do some things a little bit earlier, some babies do a little bit later. They're all say fine, but you don't have to force the baby to do it. All right. Okay. Let's move on. The next question. Good evening, doc. My baby is 12 weeks. She always tried to sit up since she was 10 months old. So I used to put her to sit. Am I doing the wrong thing? Yes, you're doing the wrong thing. Your 3 months old baby is not yet ready to sit. Okay, so when you say they are trying to sit up, what they are trying to do is to keep their head up. That is neck control. It is not sitting. Okay, so baby, when you carry them, because usually if you carry baby the way you normally carry them, like flat on your hands, then they start to bring their head up because they want their neck to be straight up. That is neck control. That is not yet sitting. Okay, sitting is the baby trying to by themselves to usually by they start to roll. 5 to 6 months again, they start to roll. When you put them on their tummy, they roll to the back or they roll from the back to the tummy, and then they start to get up as if they want to sit. So that is different from when you carry the baby and the baby bringing the neck up, which is what we expect at 3 months old. You don't have to force babies to do what they're not ready for. Remember, they still have very soft bones, very soft cartilages and all that. So you don't force them to do anything. They will do it when they are ready to. So I hope that's helpful. All right, so I hope I've not missed anybody's question. All right, so if you still have questions, feel free to post your questions, whichever platform you're watching on this minute. And like I said earlier on, if you have questions beyond our Facebook hour, beyond this ATP hour, feel free to also post your questions on our Facebook groups. We have 4 of them. So we have our ATP, the Ask Pediatrician, which is the most common group, and that one you can watch it. That is from that one is for children health issues, and we have ATP family, which is where you can post adult health issues. We also have ATP still a mom, which is more of a support group for those who have maybe lost a child or they want some support around that. And then we have ATP FTM baby care group, which is the one for those who are first time mothers. So feel free to post your questions. And if you are just joining us, remember that you can always post your question. You can always watch this video again after the live session on the same platform you're watching from. So on Instagram, it will be on our IGTV, on YouTube channel, it's always there, on Facebook page, it will be there, on our group, it will be there. So you can watch them again and you may get answers to your question. And if you still have questions, why not? You can always post them on our Facebook group from Mondays to Saturdays only. All right. So thank you so much. Just to remind those of us who have girls between the age of 9 and 14 that there's going to be the HPV vaccine immunization given to all these girls in September. So we have about 2 weeks to get ready. So go to the health centers next to you. You take your girls 9 to 14 there, they will give them the HPV vaccine. The HPV vaccine protects our girls against cervical cancers. So there are 2 major cancers that can affect women. We have the cervical cancer and breast cancers. Those are the top most killers for women. And luckily for us, when it comes to cervical cancer, if we diagnose it early, we can avoid it and it can be cured. It can be cured. It's one cancer. That's why we recommend for the older women, the mothers there, please do your pap smear. Some of you have to do it every 3 years and some after every 5 years. Do your pap smear so that if we pick it up at the early phase, we can cure it completely and you don't have to have a cancer and you'll be fine. But one of the things that has been linked to cervical cancer is this human papilloma virus. So the human papilloma virus is a viral infection that causes some changes in the cervix. The cervix is the neck of the womb, and if it causes those changes, it can lead to cancer in future. So if we give our children this HPV vaccine, luckily we have a vaccine against it, it will protect our children from the HPV infection and by extension from the abnormal changes it will cause in the cervix and from cervical cancer. So please, the Nigerian, it's not yet part of our routine immunization, but the Nigerian government has decided to start by for doing like a free one that that we just give to everybody. Children between the age of 9 to 14, take your children for the immunization in September. And I saw a lot of questions. Mothers are also asking whether they too can take it as adults. Yes, you can take it, but you are not. We are going to have to pay for your own because the government is not going to pay for your own. So feel free to go and take it. It's available. It's Severix. There are different trade names, but common trade name is Severix. So if you ask, you can get it, but you have to pay for it too. But for the children between 9 to 14 years, those are the ones that the Nigerian government is planning to give for free in September. So I will be reminding us every time I come on live or any time I'm so that I will always make sure we remind ourselves so that we don't forget. Some of you are saying I should remind you, so I'm reminding you now. Please, the vaccine is not cheap, but it's going to be given to our guests for free. So the minimum we can do as the mothers is to make sure that we take our children, get these vaccines, and help protect them against cervical cancer in future. So thank you so much. All right, seems like I don't have any questions for today. So if you are just joining, welcome. Feel free to post your questions, and I hope nobody is dropping questions on the wrong place. So let me just check for other groups. But feel free to post your question. Instagram, if you have questions, feel free to post your questions. Okay, I can't see any question on Facebook as well. ATP family, I'm just checking in case any of you drop your questions there, but I can't see any, which is okay. And if you don't have any questions, that is okay as well. If there's anything you'd like us to address, any issue, it doesn't have to be a question. If you have anything you want to have a clarification on, you're also free to post it as well. I'm just checking. Okay, all right. I can't see any questions here. So let me go back. Okay, there's a question on Instagram, Mina2909. Okay, good evening. My baby's right hand is always outstretched, right hand. How old is the baby? 3 months. Is that normal? No, that's actually not normal. I'm trying to imagine the scenario you're painting. So your baby's right hand is always outstretched. So when the baby sleeps, the hand is also outstretched. You know, if you ask, since I just try and clarify, usually most babies tend to be flexed when they are at that age. But by the time they're about 4 or 5 months, they start to. That's when their hands is a little bit more relaxed, and legs, they don't have to keep their fingers fisted and all that. So I'm not really very sure whether I'm getting your scenario because what you use though is not very clear. But if you say meant that your baby's hand is outstretched, if you try to bring it back, or like you try to change the posture, is it hard to change? Is it that the baby restrict? Does the baby cry when you try to do that? If that is the scenario, then I'm going to be worried about that. Then I really want you to see a pediatrician. So okay, so the baby's hand should be something that the baby should be able to move. You know, it should not be in one permanent posture. I don't know whether that is making any sense to you, but we want the baby's hand to be flexible, to be soft, and for the baby to move it around and not just leave it permanently stretched out in one posture. If that is the scenario you are painting, then definitely I'll be worried about it. Okay, so yeah, but it says it's not hard, and then the fact that if it's one hand, if the other hand is not like that, then that also worries us, because there should not be differences in the two hands. In other words, one hand should not be looking different or positioned differently from the other hand. So since your baby is 3 months, you're still going to go for immunization at 14 weeks. So when you go to the hospital next time, please ask your doctor, let them have a look. That kind of scenario, we really need to see the child. We really need to see what is going on. Then we can advise you. The most important thing is to make sure there's nothing neurological, there's nothing going on with the brain and that could be affecting the hands. That is the most important thing we really need to be sure of. So I'm not worried, but I really want you to have a doctor check it out for you. So when you go for your immunization in 2 weeks' time, for your 14 weeks immunization, please just make sure you see a doctor at the same time so that they can have a look at it for you. Okay, somebody say thanks for answering my first question. How do I relieve my baby from the choke breast milk? What do you mean relieve your baby from the choke breast milk? So when your baby, a shocking episode is an ongoing episode. It is something that is happening right now. So when your baby is choking, you need to hold the baby, rub their back, and usually most of them will cough or sneeze out and it will clear. But more importantly is to make sure it doesn't happen again, and make sure we know why it's happening and avoid it. So, and I think I addressed that already. So to tell you what to do, don't block the nose. Okay, when you finish feeding your baby, don't put the baby down immediately. Make sure you put the baby on the back, rub make them upright, rub their back and all that. 15-30 minutes before you put them down. Make sure the doctor check out your baby, make sure there's no abnormal connection between the airway and foodway. That's what you need to do. All right, if your baby is already choking, just take the baby in your hand, pat their back gently and all that. Most of them will be fine. Don't blow into their eyes or into their nose or mouth. All those things are not helpful. They make things worse. Okay, a baby who is choking needs to breathe. But when you breathe, when you blow into their nose and their eyes, you're actually stopping them from breathing. So they stop to breathe, which is worse. So that's what you need to do. We have a lot of videos showing you what to do when somebody's choking, so that's what you really need to do. I hope that's helpful. All right. Next question. Sorry, I joined late. Your phone battery is low. No problem. We are still here. We've not closed. Is it normal for baby to sweat when sucking? Yes, it is normal. But make sure your room is also not too hot. Okay. So people ask this question a lot, and I always ask, when you eat as well and you are eating hot food, don't you sweat? You sweat. I hope you know that breast milk is really hot. It is internal body temperature. It's how if you pass urine, when you pass your urine, you know how your urine usually feel. If you touch your body, how hot it is on your body. That is exactly how breast milk is, because it's coming from inside your body. So breast milk is hot food, and when your baby sucks, it's just like when you eat hot food, you're going to sweat. So there's no big deal about that. Just make sure your room is also well ventilated. There's fan, there's AC. Then the child will not have to sweat too much. So I hope that's helpful. Yeah, I think we've answered that question. Then good evening. My 5-year-old snores while sleeping. She opens her mouth so, and I try to close it. She had catarrh constantly. You've taken her to Cheshire Hospital. Very good. After examination, was told that airways are free. We're given drugs for catarrh, but it's been up to 8 months. She hasn't had catarrh, but that's good. But she still snores and open her mouth. Okay, so what did you see in the teaching hospital? I think that's the question. So you may want to go back and see an ENT doctor. If your child is snoring, we need to check that there are no what we call enlarged organs like adenoids or tonsils. Those are the things that tends to make children to have that snoring. And it doesn't mean that we have to do anything about it. Since your child is not having catarrh anymore, that's a good one. So sometimes as children get older, the adenoids tend to shrink and become smaller. Usually by the time they're about 6 years old, it's no longer an issue. So you may want to watch and wait and see whether it will shrink and it's no longer an issue. But if it is still an issue at the age of 6, then I think you should see the ENT doctors, and then they can decide whether they want to operate the child or not. So that's what's going to happen. But sometimes it goes by itself and we don't need to do an operation. We tend to operate if the child is having recurrent infections as a result of that enlarged adenoids and enlarged adenoids and tonsils. So the fact that they told you your airway is free does not mean your child does not have enlargement of the excuse me adenoids. They just mean that there's nothing blocking the airway at that time. That's what it meant. So you can have enlarged adenoids without necessarily having your airway being obstructed. That's the point I wanted to know. It doesn't mean there's nothing really wrong and all that. Because if your child is mouth breathing and is snoring, there is definitely something, which tends to happen mostly at night because the everywhere is relaxed more at night. So it's easier for the airway to become narrower. I don't know whether that makes sense. And that is where the child have snoring and is opening their mouth because they are trying to get in more air into their airway. So if it's just the snoring, sometimes you may just watch. But if you are worried about it, you can see the ENT doctors and then they can advise you further. Okay, good evening, ma'am. My baby's BCG did not show on the hand. Should I be worried? Baby is 7 months old. Okay, so this is one of the most frequently asked questions. When BCG vaccine is a vaccine we give to protect our babies against tuberculosis. And one of the ways by which we know the vaccine has worked or is going to work is the fact that by 6 weeks after the immunization, we should see what we call a scar, or a swelling, that's, on that site at the point where the BCG vaccine is given. And most time when we say that, we're reassured that that means the vaccine has been effective, okay? Because there's a difference between vaccination and immunization, okay? Vaccination means we give your child a vaccine. And sometimes we give your child a vaccine, but the child may not respond to that vaccine, and the child is still not protected against that disease. So what we have done is vaccination. But for the child to be protected, then we want a response, what we call immune response to our vaccination. So when we give a vaccine and the child produces immune response, and that means that is when the child is now protected against that particular disease that the vaccine protects against, then that child has now been immunized. Okay, so for BCG, when we give your child BCG vaccine, we are looking for the BCG scar as a sign of the immunization really happened. So if we don't see the sign, it does not mean that immunization did not happen. It's just that we have not seen it. So what we need to do is to check another way. There are other ways by which we can check whether immunization happened or not. So you have to take your baby to the hospital, and we can do what we call a mantle test. So we kind of challenge the baby. We'll give a kind of small part of tuberculosis to the baby, but what we are giving is a dead one. It's not going to make the child have tuberculosis, but the body will see it as if your child is having exposure to tuberculosis, and then the body will respond to that. So we are looking for that response. So usually, when we do the mantle test, we inject a little bit of dead, what we call purified antigen, part of the tuberculosis bacteria. We'll put a little bit there, and if we see a response from the body that shows that it has been immunized, has been exposed before, and it's ready to fight the tuberculosis, then we know that has happened, and we don't need to do anything, scar or no scar, your child has been immunized. But if we don't get that response, then we suspect that immunization has not taken place. What we've done is just vaccination. So what we normally do is to check first that the child does not already have the tuberculosis or any of the form of tuberculosis disease. If we may want to do a chest X-ray, make sure the child does not have TB, pneumonia, and all that. If we are sure the child doesn't have it already, then we will give the BCG vaccine again. So the BCG vaccine has to be given properly. It's an intradermal vaccine. It is given under the skin, not into the muscle. Unfortunately, some of our healthcare workers, some of them either they're not paying attention or they are just not being careful enough. Sometimes some of them just give it anyhow. So when they give your baby BCG vaccine, you should see a swelling, and then you should see something like orange skin in that area. You should see that swelling. You should see what they've given under the skin, and the skin puckered like orange skin. That is a sign that it was given properly. It must be given under the skin. It's not given into the muscle. And one of the commonest reasons why people don't have that BCG response because it was not administered properly. Some people give it into the muscle rather than into the skin. So that may be an explanation, or maybe the code chain has been broken or whatever has happened. So we just have to do it again. So that's what you need to do. So see them at the hospital, let them check again, check for mantle, do a mantle test. If the mantle test is negative or non-reactive, then we need to check your baby doesn't have tuberculosis. And your baby doesn't have tuberculosis, we will give the BCG vaccine again. All right, I hope that is clear. All right, let me just take a few more questions on Facebook that I'll come back to Instagram. Good evening, my baby is 4 years. He can't communicate with people, like talk to me about his needs, but he knows his color, ABC 1, 2, 3 to 20. What do I make him to communicate? So the most important thing is for us to know why your child is not communicating, all right? You need to take this child to see a speech therapist or a developmental pediatrician. A 4-year-old should be talking. A 4-year-old should be talking to an adult, like an adult. A 4-year-old should be able to have a conversation with full correct grammar and everything. So counting ABC 1, 2, 3 doesn't count for a 4-year-old. We want a 4-year-old to be able to have a full-on conversation with a stranger, and they should be able to understand them perfectly. So if your 4-year-old is not talking, able to have conversation, able to use needs, that child has speech delay. And it could just be isolated speech delay. It could be part of a global developmental delay. It could be part of something like autism spectrum disorder. We definitely need to see this child. So you can have us see a speech therapist. So because they will decide whether it's just speech only or not, or if it's more than speech, you have to see a developmental pediatrician. So we can do a proper assessment, and then we can make a diagnosis, and then we can talk about intervention like speech therapy and all that support that the child may need. But this child needs to see one, and the earlier, the better. All right, let's just take a question on Instagram, then I'll come back. Mina is here asking, my baby spits up so much, doesn't project, sometimes water with milk particles or with saliva mucus, most time it happens. There's nothing wrong with a child spitting up, most babies spit up. There's nothing wrong with that. Clean it and let the baby be. It will stop as it gets older. All right. Esther Norma James say my 2.2-year-old is always waking up at night, crying and cranky. Taken her to the hospital. Was told to change my bedspread. Blah blah blah. When I feed her, she still wake up frequently. He said bacteria that is something I know. Okay, the child waking up at night doesn't have to be a bacteria. It does. I mean, it has nothing to do with bacteria. It has nothing to do with infection. All right. So there are many reasons why your baby could be waking up at night. Okay, so the most common is the fact that you need to set up a sleep hygiene routine for the child. Okay, so you need to make sure you start your bedtime routine early. So there's a way to set up a sleep hygiene routine. And 2, make sure there are all those things that are not disturbing the child. So if the child is still in nappies, make sure the nappies are dry. Make sure the child have proper meals. So they should have had their dinner by 7 or 8, and make sure the child is well fed. And then you start all your bedtime routine and stuff. Make sure the room is not too hot, it's not too cold. There's no mosquito and bed bugs, things that could disturb the child. You have to look into all that first. So that's number 1. Then number 2 is to make sure that you have a proper sleep hygiene routine. For some of you, for example, if your child is sleeping so much during the daytime, then they don't want to sleep at night because they've already slept so much during the day. So you need to make sure that they don't have too much of napping in the daytime, but they sleep more at night. And some of you allow your kids to watch all these scary movies, cartoon characters and stuff. Some of them, they dream about all those things, and those things make them to be upset, and that may be why they're waking up crying. So you don't want to expose them to things like that. Screen time should have ended like before bed, before dinner, and that's it. And they should not have more than 1 hour of screen, and make sure what they're watching, you are aware of it. It's not something that will make them scared or when they remember or dream about it at night. So if you go to our Facebook group, we have a booklet on how to set up sleep hygiene routine for your child. So you may want to read through it and figure it out. That's that. But some children actually have sleep problem, like they actually have a disorder around sleep. And sometimes we have to give some of those children medication, or some children have developmental issues and they can have what we call sleep difficulties of insomnia with it. So we may have to treat some of those children with medication, but that is like the extreme after we've excluded all the other common causes of poor sleep. So that's what you really need to do. I hope Esther that's helpful. Right. Somebody say I'm back again. My 2-year-old started standing for 20-second max for now, and she can move like 6 steps max. Is there anything to encourage her to do more? Okay, if your 2-year-old is not yet working properly, that 2-year-old is having developmental delay. Yes, so she has delay. Okay, you already see a neurologist. You have done okay, fine. So yeah, so what did the neurologist tell you is a diagnosis? So I'm expecting that neurologist has given a diagnosis about this child. So I mean, your child has developmental delay, no doubt about that. So if they've done all the tests and everything is fine, that's good. So, but the child is already working, so just give the child time. But I would think the child has something going on. Okay, the fact that the test come back all normal does not mean everything is normal. It just means we can't see what is going wrong in the brain, but there's something definitely wrong. And I'm thinking if the brain is fine, then maybe what we call it may be part of what we call global developmental delay. So is the child also talking? Is the child doing all those things? Those are the things that kind of question I will ask you. There's nothing else to do for the child. Just let the child be. If the child is already standing, it's already moving 6 steps. So it's a matter of time. The child will do the other working. So you can't force things. You can't hurry things up. Everything is in the brain. So you just have to let the child do things at their own pace. That's all. But it's good that your child is already standing. That's not bad. That's good. All right. Somebody say, please, where can I take my baby for cochlear implants in Lagos? You need to ask the ENT doctors. ENT doctors do those cochlear implants. I'm not really sure I'm not sure we started doing a lot of cochlear implants in Nigeria, to be honest. But you can ask at the ENT in Lutz or Lasut. Those are the two places you can ask. Any of the teaching hospitals in Lagos, ask them if they are able to do that service. If they can't, then they will let you know where you can do it. But last I heard, many people still have to go outside the country for cochlear implants. So I'm not sure yet whether we're doing it or not. And if it's already 2 years old, that's already going late. We want to do cochlear implants before 2. So the earlier, the better. And I don't have the idea of the price. So this kind of question should be answered by the person who told you that your child needs cochlear implants. So usually if a doctor or a healthcare professional tells you about something, then it is their responsibility to tell you all the other information. So I believe that somebody must have told you your child needs cochlear implants. And I want to believe it's an ENT doctor or minimum audiologist. So they are the one that should also have that information on where you can do it and the cost of it. So, or you can Google that as well. Just Google it, cochlear implants in Nigeria. You may be able to find out that. But I know the ENT doctors are the one you should be having this conversation with, and they should be able to advise you on what you can do. And the earlier the better. Okay, and I hope it is a professional that told you the child needs cochlear implant, because it's not every child that needs cochlear implants. It's not every deaf child that needs cochlear implants. So just to clarify that. All right, I don't think I have any more questions on Instagram, and I don't think I have any question on Facebook. So I can take my time is actually up as well. All right, so thank you so much, everyone who have watched today. ATP Hour, you can ask your questions. within 1 hour, and you get your answers live. But if you still have any questions or you're just joining me at this last minute, feel free to go to our Facebook group, Ask the Pediatricians, and ask your questions there. We will be able to answer your questions. Please, when you ask your question, please be patient with us. We can't answer your question straight away. So we aim to answer your question within, we always say 72 hours, but most time we do it within 24, 48 hours. But if it's something emergency, something urgent, please don't just put it on the Facebook group, or please go to the hospital. And we have on our Facebook group what we call emergencies, when you should not ask the pediatrician. I really need to bring that up because we always assume as parents we are all sensible and we know that this is the right thing to do. But sometimes I'm seeing some questions and it worries me that maybe some of us need a little bit more support in knowing what to post online and what to go to the hospital for. So if your child has had a fall, your child is bleeding, your child is having convulsion, your child is very sick, there's no way we're going to handle that on Facebook. So you have to take that child to the hospital. So hospitals are so important. Our Facebook group, our Facebook pages do not replace hospitals. We all still work in the hospitals. All the pediatricians, all the doctors are there in the hospitals in the daytime. So we answer your questions. It's more for health education, health information, but not to treat sick children. So if your child is sick, your child has had an accident, an injury, or poison, maybe they took the wrong drugs or wrong thing, please, you have to take those children to the hospital straight away. Those are not for Ask the Pediatrician. Those are hospital cases. Anything that needs an answer like straight away, anything that you need an answer like 1 minute, 5 minutes, is an hospital case. But anything that can wait, should I feed my baby 3 times or 5 times or 10 times, or what should I give? Those kind of questions, you know what I meant. Those ones we will always be able to answer them at any time, and we can take our time. But anything that is urgent, please don't post it and take it to the hospital straight away. So I'll see you guys on Thursday, where I normally do my teachings on ATP hour. And so last week I talked about meningitis. So if you want to watch, you can always go back and watch on all our platforms as well. But this week I'll be teaching something new. So thank you so much, everyone, for joining me today, and have a wonderful day. If you are just joining and you still have questions, please feel free to post it on our Facebook group and we will answer them. So it's bye from me. Bye, everyone.